You are tuned into the Dr. Tyna Show with Dr. Tyna Moore. For more, visit drtyna.com. On this episode of the Dr. Tyna Show, we're doing a quick and dirty today, and I'm going to talk with you guys exactly the way that I talk to my patients when I talk to them about their cartilage health. Now, you're probably thinking, what on earth is she talking about? My background predominantly was in regenerative medicine. My whole day was spent helping people with binged up joints. Like they had either had trauma, they had osteoarthritis over time, aging, pain due to menopause, whatever it may be. They came to me because they had joint pain. And my job was to get them back to activity. And so right on my website, I said, I keep active people active. Like that's my whole motto and my whole mission. And it still is my mission. And so I want to talk to you guys today about your cartilage health, because you may not be thinking about it, but you may be hurting and you're wondering why you're hurting. And I'm going to tell you why. So there's a couple things that you probably have never, ever had any doctor talk to you about. You've probably never seen it anywhere on the internet. You've probably never seen it anywhere on YouTube. And we're going to cover it here today in this quick and dirty. So we've only got about 15 minutes, so we're going to jump right in. All right, so the first thing is hydration. On my patient intakes, I ask patients, how many times a day do you drink water? How much water do you drink? And it is shocking the amount of dehydration folks are walking around with. They are not only drinking way too little of water, and the easiest way to check this, guys, is just look at your urine. Your urine should be straw yellow, maybe a little bit darker, depending, but like when you wake up in the morning, but you really shouldn't have dark, especially dark and cloudy urine. Like that is a true sign of being dehydrated. This is most often in men. So men, you are the most guilty of walking around dehydrated. And this is not good news for your brain, your vascular system, your muscles, your strength, your erections, none of it. It's not good news to be dehydrated. So how does this affect your joints? Your cartilage is avascular, meaning it does not have a blood supply. And your cartilage is reliant upon you moving or not moving and getting nutrients in and out of that joint. So through movement, we load the cartilage. So it's a bouncy, buoyant substance that takes shock well, and it has a slick layer so it can glide over each other, right? So bone, cartilage layer, bone. And you've got some meniscus in there if we're talking about the knees, for instance. So we want this to be a slick, bouncy, shock-absorbing substance. It is full of hydration. It is full of an extracellular matrix. It is full of proteoglycans. And I'll talk about all of that more in a bit. But it really needs the hydration part to be buoyant and bouncy and absorb shock and remain slick. And what happens when you dehydrate a sponge, for instance, you've probably got the old sponge sitting on your counter that maybe it's the one you use for like scrubbing out the sink, or it's not getting used very often. So it gets dehydrated and it starts to crumble apart, right? It starts to break off and crumble apart. Now imagine two layers like that, just rubbing up against each other. It's not a good look. So we don't want to have dehydrated, crumbling, degenerating cartilage layers because we're totally not consuming enough water. And it's not just about water. It's about your electrolyte status, your mineral status. These are one and the same, really. And so we could really get into hydration when it comes down to mitochondria and easy water and go off on a nerd tangent. But I'll just keep it simple. Drink enough water during the day. Make sure you have enough electrolytes on board when you're doing such, and your cartilage will be so much happier, I promise you. Purity Woods harnesses the power of red maple leaf extract, which contains anti-inflammatory, antioxidants, and hydrating properties to soothe, plump, brighten, and nourish your skin, all without harsh chemicals or hormone disruptors. Their age-defying Dream Cream is a game changer. It's packed with over 25 potent ingredients, including organic mango seed butter and organic Indian gooseberry, one of the most antioxidant-rich fruits on earth. This formula helps support collagen and elastin, visibly reducing fine lines and wrinkles and evening out skin tone without without irritation or dryness. If you're ready to ditch hormone disrupting chemicals without sacrificing results or breaking the bank, this is clean skincare done right. And if it's not the best skincare you've ever used, you're covered by a 60-day happiness guarantee. And here's something else that I love about Purity Woods. They are Leaping Bunny certified, meaning zero animal testing at any stage. Plus, every order supports one tree planted, which helps restore forests impacted by wildfires. And the good people at Purity Woods are offering Dr. Tyna Show listeners an exclusive 27% off to try it for yourselves. Just go to puritywoods.com/Dr. Tyna and enter Dr. Tyna with a Y at checkout for 27% off today. So understanding the shock absorption part here, a little bit of detail on this. So because it's avascular, meaning it doesn't have a blood supply, it relies upon us loading it and unloading it. But what's happening is a lot of folks are walking around with a lot of excess weight, and it's causing a crushing load because it's so much load on that cartilage layer. And then what do? We go and sit all day. So we're not loading it. And then when we do load it, it is sometimes a more weight than we need. And this could be 5 extra pounds, you guys. The smallest amount of poundage on your knee joints really adds up. I've seen all different types of descriptions of this, but basically for every extra pound on your body, they say you're carrying 5 to 7 pounds on your knees, something like that. I mean, I don't know if that's exactly true, but we know that it is more weight than the poundage on the body because of the force that's going through those knees on the regular, because you're constantly ambulating. So just be cognizant of that. If we're never loading those joints, then we're basically ignoring them, and they don't get what they need to get nutrients in and get the waste out, right? So nutrients come in, the molecules, nutrients, micronutrients, macronutrients, minerals, everything that we need, hormones, everything goes into the joint and it's utilized, and then there's waste product, and we have to get that waste product out. And that is happening through movement, not because there's a blood supply coming in and doing its work there with blood. So understand that, and understand that that needs to be hydrated in order to work. And you will start thinking more about your cartilage and taking good care of it. The second thing to remember about your cartilage is that it is made up of collagen, proteoglycans, and again, water. Proteoglycans are what keep it slick, buoyant, and hydrated. And they are specialized proteins that hold water like sponges. So if there's not enough water, the proteins can't hold the water. You can't get the buoyant, slick, cushy impact of your cartilage. If you stop moving, these degrade. So this is that dehydrated sponge. So load your joints regularly, move through full range of motion. Do not lose your range of motion, guys. If you're in my 21-day strength and resilience challenge, you know we were talking about keeping good mobility in the joints. Stay hydrated. Using things like collagen, hyaluronic acid supplements, I think that's great. But what I would say first and foremost is just get enough protein and make sure that you are eating. I really like bone broth. I think bone broth is a great thing to do if you're having any kind of joint dysfunction. I really like whole foods. I do like collagen products, but I really like whole foods as well. I do put collagen in my coffee every morning, but I really like whole foods and I really like bone broth. And then inflammation is going to degrade your joints. Insulin resistance is going to impact your joints very negatively. And then having your estrogen or your testosterone bottom out is also going to impact your joints very negatively. Insulin resistance starves your cartilage cells. That's the simplest way to put it. So we can't get the glucose into the chondrocytes to do the work that we need them to do. That's the cells that make up your cartilage, is chondrocytes. They can't do their job without proper glucose function. And that can't happen if there's insulin resistance in the body. So you have insulin resistance in the body, you have insulin resistance in your joints. And it's a slippery slope. So this is why I say ultimately that I think the osteoarthritis is most often diabetes of the joints, is because people have this elevated insulin. It's not working. Glucose uptake becomes dysfunctional. Things aren't working right. The cells are essentially starving. And when they starve, they start secreting inflammatory markers, or the joint starts calling up inflammatory markers. It turns into a big mess of inflammatory markers. And now the joint's pissed off and it hurts. And that leads to further degradation and destruction and further chondrocyte dysfunction. And this is why I say it's a slippery slope. It just leads to accelerated breakdown. And things, when they start to go, they go fast. Any of you who have knee osteoarthritis know what I'm talking about. One day you're fine and the next day you're not fine, right? It's just, it sneaks up on you. It's because this process starts. And once it starts, it's really hard to get out of that loop and it can become a bit of a slippery slope. So your metabolic health really determines your joint health and ultimately your cartilage and chondrocyte health. I'll leave it at that. So high insulin also alters synovial fluid composition. Your synovial fluid is the goo that is inside your joints. It is liquidy and kind of gooey, but it shouldn't be too gooey. We don't want it too thick. And I've had to drain some joints before, and man, they can have some really gelatinous, thick consistency. That's not great. We don't want it to be, watery thin. It's got a bit of a slick to it. And so that slick is due to the nature and the composition of that synovial fluid. And we want that healthy. We want that nice and smooth. I've seen chunkers in synovial fluid, floaters, if you will. I've seen all kinds of stuff in synovial fluid. You can see it under ultrasound. You don't have to pull it out of the joint to look at it. I'm telling you, synovial fluid gets goopy. And I see this most often when people's hormones are out of whack and when their metabolic health is really out of whack. And so we want that insulin to be kept in check because we want that nice synovial fluid composition. And then we have things called AGEs, which are advanced glycation end products. They basically are sugars that caramelize, if you will. Due to inflammation in the body, the sugars caramelize and they wreak havoc and stiffen your cartilage as well. So all this to say, this is where the diabetes of the joint concept comes in that I say so freely, and people do like to push back on that, but I'm trying to explain why I say it is the way it is. We're going to get those AGEs and that inflammation when blood sugar is dysregulated and when our metabolic health is kind of gone screwball. And this happens as we age. So we get AGEs as we age, right? We get these advanced glycation end products as we age. And it's that inflammaging. I've also been made fun of that, but that's a medical term, inflammaging. You can look it up. It's the process of having inflammation come on as we age. It's a natural part of it because we become more insulin resistant as we age. And part of this is due to the waning estrogen that's happening. Also, I would say waning testosterone. So as we go through midlife and we start to hit menopause or andropause is the male version, we start to lose the benefits of estrogen, and estrogen keeps us juicy, if you will. It keeps us juicy and fluid and mobile. It keeps us from getting stiff. It keeps us elastic. And the same is true for the cartilage in your joints. And so we do need estrogen. We also start to get an upregulation, like I said, of these inflammatory markers as we lose hormones, as we see this metabolic syndrome set in. We start to lose the protection of estrogen. We start to see an increase in the inflammation. And so we start to see a decrease of what we need inside that joint to stay healthy, just to keep it simple. And so this isn't just get your metabolic health in check or get your hormones in check. It's a both scenario. And it's a use it or lose it scenario. And it's a hydrate it or none of it's going to go well scenario. So I hope that helps. Obviously, we could unpack this further and go deeper and nerd out on it. Let me make sure I didn't miss any of my notes here. Pain. I will say this. The pain receptors in your joints start to shift and move in the presence of joint degradation. So for instance, in the hip, we have proprioceptors and we have pain receptors. And they will start to move position depending on how that joint health is going. And it's happens in such a way that the proprioceptors, those are the receptors, the nerves we have in the area to tell our joint where it is in space. And then we have pain receptors, so we don't go too far, right, with the joint. And they'll start to move and pivot. And so you start ending up with pain receptors where there should be proprioceptors. And this is what happens in the sequence of joint degradation. We also know that there is the musculoskeletal syndrome of menopause. We're getting a lot of data coming out on this lately. This is something I've been treating in my clinic for decades, and I have been utilizing HRT for decades when it comes to the middle-aged man or woman and their joint pain. It's an andropause syndrome of, musculoskeletal syndrome of andropause too. We got to include the men here. It really can cause a lot of pain and a lot of rapid joint degeneration out of nowhere as those hormones drop off the cliff. So this is why I say consider HRT sooner than you think you need it, because once it starts happening, it's very hard to catch up. And once it starts happening, it thrusts you into metabolic dysfunction as well, because you become more insulin resistant. Your lipids will suddenly get off. So then they're like, oh, you need a statin. Well, guess what statins do? They cause further this is the irony. Statins have been definitively linked to inducing really difficult to treat diabetes, type 2 diabetes, metabolic dysfunction, insulin resistance. We have the data on that. I'm not making this up. We've known this for a long, long time. It's one of the reasons I happily would get my patients off of statins as soon as I could, but they also cause joint pain. And so the person stops moving. That's the irony of it. And it's all because, honestly, in most cases, they need some thyroid and they need some hormones, especially if they're middle age. So it's all being handled terribly unfairly, I think, in the conventional allopathic community. And these things are not considered, and they should be, because there's a lot of pain happening for people. And then the next thing you know, oh, you have metabolic dysfunction. Well, was it the metabolic dysfunction there in the first place? Was it induced by the low hormonal profile? Was it induced by the statin? Was it induced because the statin made the joints hurt worse, and so they stopped moving? And when they stopped moving, they started gaining weight and they started becoming more insulin resistant. Like, you see the slippery slope that this becomes in middle age. And this is the story for so many middle-aged folks that walk into my clinic. And it sucks because they say, what do my hormones have to do with my joint pain? What does my blood sugar have to do with it? And I'm like, it's everything. It has everything to do with it. So I will leave you with that. This is our Cartilage 101 primer. At the very least, guys, hydrate, hydrate, hydrate. Take your electrolytes, your minerals. Make sure, because that'll help the water get to where it needs to go and stay in the cells. Make sure that you're using them or you're going to lose them. We want to load that cartilage, but we don't want to load it too much, and we don't want to just let off of it and not load it at all. Make sure you're going through full range of motion. Very much consider, is your metabolic health kind of taking a dive off the cliff? And if it is, and you're around my age, I almost want to guarantee that your hormones are playing a role in there, okay? I won't be so bold to say as always, but because a lot of that is lifestyle. But for instance, I just got my labs back this morning, and I am just tinkering again on the edge of insulin resistance, and I'm microdosing a GLP-1. Why is that? Massive stress. Plain and simple, massive stress. And my thyroid, my autoimmune thyroid decided to rear its ugly head again and have a flare up. And in that, we start to see the pieces, it's like dominoes start to fall. And so it's not just get to the gym more and eat more protein and dial everything in that way. It's like, I need more sunlight. Dr. Jack Kruse would say, I need more sunlight and not worry so much about the food. And he's 1,000% right. I need more sunlight. I'm in Oregon. I'm in the depths of winter here in Oregon. I could really use 2 weeks just in the sun somewhere. Stress has been very high. There's all different kinds of factors to consider, but just to say, I don't want anyone to think that they're not trying hard enough, because cortisol and the stress of that will also make all of this worse. But your joint pain is real. There are good, strong reasons for it. And there are ways to start working through this by finding a good functional medicine practitioner who can help you. I have a great resource. I cannot make personal referrals for you guys, but I have a great resource on my website. It's drtyna.com, drtyna.com/find a doc. And I have a 30-minute video on there of what I would look for in finding a good practitioner. You really have to find somebody that you can work with. Trying to convince your doctor to figure this out for you is challenging. And that's like a whole education that they don't necessarily have. A lot of functional medicine doctors and naturopathic doctors don't understand hormones either, and they don't understand musculoskeletal medicine to save their lives for the most part. And then you go to the chiropractor and they'll understand the musculoskeletal part, but they don't necessarily understand how to utilize bioidentical hormone replacement. So my dog's barking. I got to go. I hope you enjoyed this quick and dirty episode. If you did, please rate, review, and subscribe. give me a follow here on YouTube, and I will see you later. Thanks for listening to the Dr. Tyna Show. This is a Wellness Loud production produced by Drake Peterson and mixed by Mike Fry. Theme song is by John the Guilt. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.